Yo, yo, yo. Am I live? I think I'm live, y'all. Man, it's the hood up in this man back. Good morning, good afternoon, good evening, wherever you are in the world. Freedom marchers, freedom family, freedom lovers, and freedom fighters. Snapzilla Gorillas in the building. Hitting y'all with this quick live stream. We're gonna get into this, you guys, because it's very important. It's very important. Salute to Realize in the building for being in here early. She says, I love this title for those in the chat that are free thinkers and those who follow the sheeple. If you don't know, now you know. Yes, I'm going to get into it. I'm going to get into it indeed because I like to provoke thought, you guys. What kind of crazy title is that? Fuck your government healthcare? Universal healthcare? Why would you say that? Snapzilla, don't you want free health care for everyone? Don't you think and believe that everyone deserves health care? Well, see, these are very interesting questions because it's not up to me to decide who doesn't deserve health care because I'm not trying to be responsible for whether or not someone has health care. If I don't know you, if you live in Washington State and I don't know you from Adam, why would I feel responsible or why would I believe I don't know you? Let's start with that. Let's start with, do I know you to know whether or not you deserve health care? Now, on the surface, everyone deserves to be healthy as they can be. And more importantly, no one has a right to make you unhealthy. Let's start with that. Everybody deserves for no one else to make them unhealthy. More so than whether or not I think they deserve to be healthy, right? Now, that's a whole different ball of wax. But when we talk about this healthcare thing, when we talk about universal healthcare, when we talk about the government running universal healthcare, we have to start to kind of unpack what that really means, guys. We got to unpack what that really means because all you got to do is look at the healthcare system that's in place right now, right? And right now we have different types of healthcare. We got private healthcare, right, where a person can basically pay for their own healthcare, right, out of their own pocket. That's completely private. Like you go to a doctor and you go over the cost. They tell you, oh, well, for this consultation, it's $500. All right, boom, I'll give you $500. All right, you get a 1 hour or 30-minute consult. And then you go over a healthcare plan if you need it. You might get a checkup during that consult, right? There are certain things that can occur with that's private healthcare. You pay completely out of the pocket, but you choose which clinic you go to, which doctor you want to use, whether it's a specialty or not, whether you're going. That's all completely up to you. You decide with your own money who you want to treat you. That's private healthcare. And that is the only private healthcare that really exists. Right? Now, you also have company sponsored healthcare. You work for a company, they pay part of the cost for your healthcare, or all of it. Some companies you get the extremely basic healthcare. They pay for 100%. They pay the premium. Right? Nowadays, pay the deductibles. And you get a certain amount of coverage. Right? But there is a certain system, a certain pay system, right? So once the insurance companies get involved, well, they determine how much coverage they give you based on what you're trying to do. And sometimes they'll say whether or not they'll cover something. They get to pick and choose, right? That is company sponsored healthcare, whether it's government paid or private company paid, right? And then you have the healthcare that you get that the government provides, government healthcare. Government healthcare is like the VA. That's government healthcare. So if you want to see what universal healthcare that's completely ran by the government, no privatized healthcare, everybody gets healthcare, it comes out of your tax. You don't pay co-pays, you don't pay for you don't do any of that. Well, look at how the VA is ran. Scale that up to 350 million people. And that is what universal health care is going to look like. Point blank and period. And not just the VA, right? You have hospitals that are ran by the state. You got hospitals that are ran by the government, right? Like Martin Luther King Hospital, hospitals like that are in the hood. Yeah, hospitals and clinics that are in the hood, you go up in there, you might see somebody with a gunshot wound over there and somebody with diabetes over there in a wheelchair about to get their leg cut off. You might need to go to the emergency room. You're going to be waiting 30,000 hours with a gunshot wound to the throat. That is what public healthcare system looks like. Right? Now you're talking about, well, let's scale that up because everybody deserves health care. Sure, let's say everyone deserves health care. But does that mean that the government should run that health care? Should it be government ran health care? Government ran universal health care where they have to cover 350 million people year round, 100% free. Because that's what we're talking about, right? When we talk about universal health care, you're talking about health care for everyone with no financial burden to the people that are covered. But there is a financial burden because you have to get taxed for it. It comes from your taxes. Whether it's already earmarked, whether it's already a certain amount and they allot a certain amount to it. Well, there is a financial burden for that healthcare. It's not free. See, they tell you it's free, but it's not because you're not paying upfront cost. You're not paying out the pocket right away. No, they're taking it out of your paycheck. Right? They're taking it out of your paycheck. And everyone gets healthcare. But the government runs that shit. That means that the government, like it does with everything else that they run, is going to run the same way. It's not going to be what y'all think it's going to be. Right? Let's just start with the surface shit. If you ever go into a county hospital, right? You have county hospitals. You got hospitals that are ran by universities. You got university hospitals, which are essentially private. You have hospitals that are ran by organizations like Prisma, like Kaiser, and things like that. And then you have smaller clinics that you can use PPO insurance for. You have all these different ways to get health care. You have all these different options, right? You get to pick and choose essentially. Like if you work for a company and they provide health care, you get to choose, bronze, gold, silver. You get to make those decisions, right? And you pay a certain amount for it. But at the same time, right now, you're also getting money taken out of your paycheck for Medicare, right? Medicare, Medicaid, and all that type of shit. They're already taking your money out for healthcare. They're already doing it. So yes, they already taking money out of your paycheck for healthcare that you're not even able to use, right? You can't use it, but you already having your money taken out. Now, imagine the only options you have is government healthcare. That means what? That means there's no competition. That means that it's in the bag. They have a monopoly on healthcare, right? So you don't get to necessarily pick and choose, right? You got to roll with what they want you to roll with, right? And if you want to get specialty care, you want to get alternative care with alternative medicine, you might want to go to a chiropractor. You might want to go get him, you might want to go do those types of things. You're not going to be able to do that without coming out completely out of your own pocket. But the insurance that I have right now, I can use it for a chiropractor. I can use it for different things. I can use it for alternative medicine, if to a degree, because the insurance companies will still put restrictions on that type of stuff, right? So when you involve government and you completely remove private healthcare, you're going to greatly limit your options. And if you have to get specialty care and you don't want to wait 3, 4, 5, 6, 7, 8 months to receive any type of treatment, then you're going to be coming out of the pocket. And who knows if they're even going to be allowed to have those types of things going on. So once you put all that shit in the hands of the government, they might say, nope, no more chiropractors. You never know. You don't know what these people are going to do. Once they get complete control, right, over healthcare, man, you are giving up a lot. You're giving up a lot. You're giving up a lot. You're asking for universal health care ran by the government. You're asking them to take complete control over your health if something happens to you. You look at these other countries. You look at Canada. You look at Israel. You look at all these other nations that have this universal health care, and you think, oh, well, look how great they're doing. Look how great that is. Well, ask some of these Canadians how it works with them, how long they have to wait to get a checkup, how long they have to wait to get certain types of treatment. Ask them if they're not coming to America to get other choices, to get different types of treatment so that they don't have to wait. Ask them. We have no idea what we're getting ourselves into when we ask them to take control of that. Right? As of right now, Big Pharma, right? Big Pharma, all these hospitals, these big organizations, they're already government subsidized. These hospitals, they're all government subsidized. They get money from Medicare, right? The CDC oversees them anyway. They have to, they get instructions. The CDC oversees, the National Institute for Health. All these, they're government subsidized already. And if you don't take any money from that, right? If you're a private clinic, right, and you want nothing to do with that, right? Then guess what? You're not going to get that money. You're not going to get that Medicare money. You're not going to get any of that. These hospitals during COVID-19, they were getting paid by the government when people got put in the ICU when they had COVID-19. They were incentivized, right? When people were just the diagnosis. You get diagnosed with COVID-19, you got incentivized. If you ended up into the in the ICU, you got more money per person, per individual. You got bread, you got broke off. If you ended up on the ventilator, you got more money from the government. You die from COVID, you get even more money. But see, it's not just with COVID. So even with private insurance companies and big pharma, they form special interest groups that already dibble and dab with the government. They already are in this partnership with the government, with these with the representatives and all this other shit. They already, listen, they set these prices, right? For these medications, all the treatment, right? The government regulates all that, but they really don't. Because these insurance companies, big pharma, they get government incentives. And what are they incentivized to do? Keep your ass sick, to keep you medicated. It's really the sick care system as it is already. Salute to Black Spring with Autumn. Salute to you, Queen. The government gives these companies incentives, right? They work together, big pharma, the big insurance companies, and our politicians. They all work together to keep you sick. So they don't believe in healthcare. And that's another part of why I say, why would I want the government to run the healthcare system when they don't care about healthcare? They don't give a hot damn about nobody's healthcare. Didn't they demonstrate that? They demonstrated that ultimately during COVID-19. And we just seem to have forgotten. Because the healthcare system is about lining the pockets of big pharma, big insurance, and the hospitals and the clinics, right? The bigger hospitals, the bigger clinics, right? The vaccine schedules. The Fab Five are back. I mean, the vaccine schedules. All these medications, they run ads for on television that tell you it's supposed to help you get better. Oh, you got restless leg syndrome, take this medication. And then they rattle off a bunch of side effects, including heart failure. Our government allows these people to push these drugs onto us. These are drug peddlers. The government, with the presence of private insurance, without universal health care, incentivize, right, these companies to peddle drugs to you right now. Now, when it comes to universal health care, it's going to just get 10 times worse. Yes, hit the like button if you're in here. Right? Because they have no interest in healthcare. Like I said, they have interest in treating illnesses. They want to treat illnesses. They want to treat sickness. This is what they do. It is a meal, right? It's a revolving door of sick people going in and out of these buildings, right? It all works in conjunction. You know, the doctors, the insurance companies, the doctors, the insurance companies, and the pharmaceutical industry. They all work together to keep you sick. These doctors go through medical school and they go through particular types of training, right? They go through all this training, but it's like, okay, it's like an assembly line. Are you going to learn this for a certain amount of hours? You're going to learn that for a certain amount of hours until you get into your specialty. But they don't ever, they ask these doctors how much time they spend on proper nutrition, exercise, right? Metabolic health. They don't spend much time on that at all. They might glaze over it. They gloss over it. And then when you get to your specialty, if you want to specialize in nutrition, then they have a whole nother system for that. Right? and listen, they learn these doctors learn, and they tell these doctors, right? The American Diabetes Association, and American Heart Association, they tell you, if you're diabetic, that it's okay, right? If you have type 2 diabetes, it's okay to eat a big old bowl of oatmeal. That's what they tell you. Oatmeal is safe for diet. That's what they tell you. They tell you, oh, you can load yourself up. Load yourself up with this carb. Load yourself up with that carb. Eat all this sugar shit. It's okay. Eat all this processed food. It's okay. This is what the healthcare system is pushing, right? It's not about keeping yourself healthy so that you never have to get diabetes, and you never have to get treated for diabetes, and you don't have to be told, eat a bowl of goddamn oatmeal to reverse diabetes. Oh, yeah, it's okay. Just eat some oatmeal. Oatmeal is one of the highest foods. It's super high on the glycemic index. People test it all the time. They had that continuous glucose monitor. I work with a guy who had a continuous glucose monitor. He ate oatmeal. The sugar spike was ridiculous. An hour later. About as high as a donut. This is what they tell you. Oh, yeah, eat this sugar shit. Eat that sugar shit when you have diabetes. They test your A1C. Right? They have certain protocols when you do all this testing, when you go get your blood work done. They don't ever give you a completely full panel because they're not interested in preventing, right? They wait until the problems have cascaded to a point where now, oh, well, we got to put you on this drug. We got to put you on that drug. You got high cholesterol. Oh, we got to put you on statins. This is what they want to do. It's automatic. That's the healthcare system. That's already incentivized and subsidized by the government. When it comes to like diabetes, right? For instance, I shared a video. I shared a live stream this morning. Oh, I shared a video. Salute to Insane. Yeah, California love, bro. Salute to you. I shared a video this morning with Dr. John Campbell. He's talking to a doctor, another doctor. And he's talking about, in particular, diabetes and how the healthcare system is not designed to actually prevent diabetes, right? The healthcare system is designed to treat diabetes. And they're not giving patients real information about how they can reverse diabetes or never get diabetes in the first place. Right? Because they don't care. They want you to have diabetes. I think he said in the United States, over 70% of people in the United States has diabetes. 70%. 70% of people in the United States has diabetes. And the healthcare system that's in place, that's regulated by the government, the healthcare system, they're not telling people, right? They're not telling people you fat than a motherfucker. You need to go, you need to go lose some weight. You need to go do some cardio. You too fat. I ain't even got to check your A1C. I can tell right now, you're metabolically unhealthy. No, they're not telling them that. No. You can't tell people they're fat no more. You can't tell nobody you a fat, sloppy, obese motherfucker. You can't do that. Because then you get canceled. Don't tell nobody they fat. Don't tell nobody to go exercise. Don't tell nobody to put the fucking fork down. No. No. Let them eat what they want. Let your fucking children pig out. Let your children eat whatever they want. Let them eat a bunch of sugar shit. Let them eat a bunch of processed foods. Let them inflame their entire body. Let their body just the stress, let it all just get inflamed. Inflammation all over the place. You don't want to hurt your child's feelings. You want to be their friend. You don't want to say, no, you ain't eating no sugar shit today. How about you eat? No, you ain't eating a piece of toast. No, this morning, you have one piece of toast later on. No, you don't want to do that. You want to let them have the potato chips. You want to let them have the processed jelly with the high fructose corn syrup. Yeah, you want to give them all this shit. Yeah, this is what you want to do because you don't want to hurt their fucking feelings. And this is how the healthcare system treats the patients. Yeah, the doctors don't want to tell you fat. They don't want to tell you get your ass out there, walk an hour a day, put the fucking fork down, stop eating sugar shit. Because that sugar shit is going to kill you. Yeah, you dying right now. Yeah, everybody dies. Yes, Cowboy Baby Yoda says, America glorifies these mukbang videos. Yes, get Ozempic. And this is the answer, right? Yeah, let's get this Ozempic. Destroy your fucking gut. Yeah, let's do that. This is the healthcare system that we have in place right now. Universal healthcare is not going to change that. It's just going to make it, you think you're getting free healthcare when you're getting free sick care. And you're going to wonder why you look up and everybody is fucking in wheelchairs when they're 50 years old. They done been Ozempic out the game. Everybody's on Ozempic now. Yeah, everybody's on Ozempic. Now, I want to pig out for a couple months and then take Ozempic and not move my fat ass. No. I want to go the easy route. This is what the sick care system is doing to everybody right now as it is. So when the government controls all the healthcare, all this free universal healthcare, they're not going to have any interest in a healthy society. They're not going to have any interest in that at all. They want you to be slothy, sloven, fat, fucking, that's what they want. And then they want you to get on the Ozempic. They want you to believe, oh, well, I got to get on the Ozempic now. I'm a fat motherfucker. Let me go get on the Ozempic and have another cascade of problems. Yeah, let's do that. Yeah, let's eat away at my muscle tissue. Let's get, all those health influencer. Shout out to the fitness influencers out there right now that are pushing the opposite of what the healthcare system is pushing, right? They're telling you to run. They're telling you to get 150 minutes of cardio in a week. They're telling you to go lift weights. Sure, they're telling you that, right? They're showing you what you can eat in a day to get fit. But they don't have access to you like these hospitals and these doctors do, right? You can't go visit them. They can't hold you accountable because they're looking at you through a fucking screen, right? or you're looking at them. They don't see you. How many people have fitness trainers right now? Personal trainers right now that they go to. You have less and less of that. Right? And in order for these fitness trainers to make a shitload, to make a decent living, personal training, they have to train 50, 60 people a day. Right? They got to train 50, 60 people a day. Right? Well, I'm exaggerating. But they got to, listen, 10, 12 people making what amounts to minimum wage. Or a little bit more. And if you have a fitness trainer that doesn't work at a gym, well, he's going to charge you up the yin yang, he or she. Because now they got to drive around. They got to meet you where you at. They got to go to this part. They got to go there. They got to set up. Oh, they're going to charge you. They might charge you $50, $60 an hour. Yes. And if they're just training you, they want to make $300, $400, $500 a week, a day. Yeah, they're going to charge you up the yin yang. Yeah. It is what it is. See, I believe that a true healthcare provider is going to be like that fitness influencer that you see on YouTube or on Instagram. They're going to be doing that first. So you go to them, they give you 20, 30 minutes, right, for your checkup. Instead of asking you, well, how do you feel? Your ankle hurts? Your knee hurts? Meanwhile, you 30, 40 pounds overweight. And they ask you your knee, if your knee hurts, and they ask you, well, did you injure yourself, or did it come on suddenly, or did it just happen? Oh, it just started happening, you know. My knee hurts. And they're looking at you. You weigh 30, 40, 50 pounds overweight. And you wonder why your knee hurts. Because, well, guess what, motherfucker? Your knee should not have an extra 50, 60 pounds bearing down on it. You might want to lose that. Your knee will get better. You might want to eat better. You'll lose inflammation. And that'll make your knee feel better. No, they're going to give you some pain medication. They're going to say, oh, well, you know, we'll put you through some. Why is your knee hurting? They'll put you through x-rays. They'll give you x-rays and all, try to find out if you got a fracture somewhere. They even charge for online training. Yeah, they do. But see, the healthcare system, universal healthcare, they're not going to pay for fitness trainers to help you get fit. No, they're not going to do that. So you weigh 40, 50, 60, 80 pounds over what you should. And your back hurt, your knee hurt, your hips hurt. And your doctor's looking at you like, man, you... Yeah, they're just going to medicate you. Because they don't want to hurt your little feelings. And they want to get paid. They want to make sure that the drugs they invest in get used. The government has no interest in making sure you get fit at all. They have no interest in making sure you're metabolically healthy at all. Yet you want these motherfuckers to run the whole healthcare system in the entire country, and just so that everyone can get free healthcare. That's what you want. You want the government to run healthcare 100% completely. Well, they already run healthcare. It's just you pay. Some of you pay for it out of your pockets. Some of it get it because you're on welfare and you're going to the county hospital, or you're going to a clinic that will take Medicare 100% to treat you, but you're not going to get priority. That's all that is. Yeah, they'll pay for your groceries, but only $200 a month. You let the government run the healthcare system. They already run the healthcare system. Let's not make no mistake. Whether you pay for it out of your pocket or not, they already run the healthcare system. right? Look at where all the money goes. Follow the money. Follow the money and you'll find out. Find out who creates these laws around healthcare. Guess where the money goes? All the research, all this shit. It all circulates right up there in the elite class anyway. Yeah. But when they make it free for everybody, well, you ain't gonna have shit to say about it. They're gonna tell you to shut up and get whatever treatment we allow you to get. Or you're on your own. Well, you're better off on your own. And use them when you need them. Like when you break a leg. Or when you break something or you get cancer. Right? But they have no interest in preventing you from getting cancer. They want you to get the cancer. They bombard you with everything that they can to ensure you get cancer. From the food, right? To the medications, to the vaccines. They bombard you. They just saturate you with the things that can get you cancer. They because they want that. Yeah. The same healthcare system that allowed COVID-19, the COVID-19 vaccine, to be administered to millions of people without going through all the rigorous testing and trials and studies, which take years and years and years. All this, the Food and Drug Administration giving Pfizer, Moderna emergency use authorization. Yeah, that same government that allowed that to happen. That's the one you want to give us universal health care. The very same. Not killed, but it made it too expensive. What do you mean not killed? Dead Mike, yes, he did put in a stunning. It wasn't stunning. I was unimpressed. Cowboy Baby Yoda says they even charge for online training. Oh, yeah, we already said that, talked about that. Yeah. The COVID-19 vaccine, which is now being shown to be linked to the increase in cancer. Yeah. Your government allowed that to be rolled out to the people. Boost the new king at 154. Knock it off. Knock it off. Knock it off. Who was Lima? He beat Lima and now he's the king of what? Stop it. Knock it off. Yes, the same government that brought you the COVID-19 vaccine and other vaccines that are now being shown to cause injuries, even after all the years of testing. That's the very government that allowed that to happen. That's the one that you want to run the universal healthcare system. Does everyone deserve healthcare? Well, the question is, does anyone have the right to make sure you don't have health care? That's the question. And no, they don't. But your own health, ultimately up to you. You eat the right things. You eat what's right for you, right? Because there's no one way for everybody to eat. Find out what the right way is for you. Exercise, right? Yeah. Eat right, exercise, and sometimes people have congenital conditions that they can't control. It is what it is. That's just life. Some people are born with conditions that make them unhealthy. And at that point, sure, maybe, yeah, go through the healthcare system and get treatment to have the best quality of life you can. Right? Yeah. In that case, you really ain't got no choice, right? Because you cannot survive without that type of treatment. You can't survive without that medication. You can't survive without that going to get dialysis. You can't survive without that the nitrites or the nitrogen pills. You can't survive without it. Sure. In some cases, you have to use the healthcare system. It is what it is. Either you can have some quality of life while being medicated, or you can die early. But generally, for generally healthy people who start off and are born and are children, and you are metabolically healthy, no congenital conditions, nothing like that. Yeah, your health is up to your parents, and then once you become an adult, your health care is up to you. You are the most interested. You have the most to invest in your own health care. No one cares about your health care more than yourself. These doctors, I mean, they run people in. They see dozens of patients a day. They don't have time to care about one patient. No, they gotta go through their routine. They gotta go through. Oh, I learned this. Oh, if this person tells me this symptom. Oh, he has this symptom, that symptom, that symptom, that symptom, that symptom. Well, I'm going to diagnose them with this. So they spend most of their time diagnosing people. That's what doctors do. When they treat you, when you go see them and you telling them what's wrong with you, they're trying to find out what's wrong with you. They're trying to diagnose you. So they're going to spend most of their time diagnosing you. Once they diagnose you, you know what they do? They go to their little book and they say, well, if this guy has this condition, I give them this medication. That's how it works. It's a pill mill, right? That's what the healthcare system is right now. Trust me. They're not selling the U.S. anything real. No, they're not. Once a week, you go to the taco truck. Why can't we study and adapt successful universal healthcare systems? Taiwan, Korea, Israel. Well, I lived in Korea. Wow. Well, number one, you have to understand these countries get a lot of money from the U.S., right? Israel gets billions of dollars from us a year, and they use some of that money to their benefit, right? We don't get money from countries like that. So, and Korea as well, because we have military installations there in South Korea. And yes, they might have universal health care, but see, they operate differently. They have a different culture than the United States, right? Most Asian countries, they focus on healthy eating and whatnot, right? They've been eating the same way for centuries, right? In some of these countries, outlaw food ingredients that our country allows the companies to put into our foods. So it's a different dynamic. And I would not say it's successful. We have to find out, because I don't know much about South Korean healthcare, although I lived there, right? I lived in South Korea for about a year. They generally are fit people. You don't see very many obese South Koreans. We got to start there. right? You don't see very many obese South Koreans, and I don't know nothing about no Israel. So, but I don't think I've seen a lot of obese South Koreans or Israelis. But look at the United States. Yeah. A lot of obese people in the United States. A lot of obese people in the military. Which is diabolical, by the way. The amount of obese people in the military is crazy. So, that's because the healthcare system in the United States operates one way, and the healthcare system in South Korea operates a different way. Right? I believe it's in Japan where I think it's one of these countries where they regulate how much somebody can eat or some shit like that. Some crazy shit, which we don't want, right? We don't want the government telling us how much food we can eat in a day. But really, it's about education and encouraging people to be fit, be healthy, not rely on the healthcare system, right? To reverse sickness. Focus on preventing the sickness in the first place by reducing inflammation, right? Reducing inflammation. That's a lot of sickness comes from inflammation, right? Inflammation, right? The more inflammation you have, the more stress your body is under, because you got the stress hormones. You got cortisol and you got adrenaline, right? Well, there are certain environmental factors and certain foods that can increase the level of cortisol our body releases, which causes more inflammation. The more inflammation you have, the more bad things are going to happen to your body. Yes, there are doctors that we have that aren't too healthy at all. Yes. Right? And so, if you look at the cultures of different countries, right? If you look at how most countries regulate food and what companies are allowed to put in their foods, you can start there, right? Certain countries don't allow dyes. They don't allow high fructose corn syrup. They don't allow industrial seed oils in the foods. They don't allow a lot of the processed shit in their foods. You start with that. You look at that. And you look at what they are allowed to put in the foods in this country. Yeah. A lot of links. Right? And you would think, well, we have a healthcare system that wants us to be healthy. They should be sounding the alarm. They should be pushing to have these products not in our foods, right? They should be pushing. They should be lobbying to create laws to get that shit out of our diets, to get the industrial seed oils out, to get the dyes out, to get the high fructose corn syrup out, to get all the sugar shit out, the processed sugar. You would think a healthcare system, which includes big pharma, which includes the insurance companies, you would think, well, we should be lobbying to create laws to outlaw this poison. But they don't do that, do they? No, because you got big food to contend with. And they all work in conjunction to get as much money out of you as they can. And they need the lawmakers on their side. So they incentivize the lawmakers. They, give donations to these lawmakers. It doesn't work in your favor. So if you look at countries like Israel, you look at countries like South Korea and the UK and all these other countries where they have universal health care, but they're not as sick. France, they're not as sick, right? Well, their healthcare system operates a little differently than ours. Our healthcare system is predatory. Big pharma is predatory. Um, Big insurance is predatory. The food companies are predatory, right? And the government allows this. Our regulators allow them to perform predatory practices on the people. And this is the same government we want to be in charge of universal health care for everybody. That's what we want. Vanjie says this is a much needed conversation. Absolutely it is. Yes, certain hormones trigger weight gain, but certain environmental factors and certain things that you put in your body triggers these hormones. So when you talk about, for instance, insulin sensitivity versus insulin resistance, well, we are bombarding our systems with sugar shit all day. Bread, oatmeal, cookies, cakes, potato chips, all that shit. All that turns into sugar. It gets broken down into sugar in our bodies. Our pancreas has to release insulin, right? To capture a lot of this so our cells aren't being overwhelmed. So that our cells can properly take in whatever it needs and use it for what it needs to be used for. Or what it can be used for. Right? But all this insulin release, our body becomes resistant to it. And next thing you know, it just creates a problem, right? It gets turned into fat cells, and it gets turned into fat. It gets turned into stored fat, visceral fat. It causes inflammation all over the body. Cholesterol that they talk about, this oxidized cholesterol, right? And I'm just talking about the sugar. I'm talking about sugar shit. That's what I call it. Because when I say sugar shit, I'm not just talking about table sugar. I'm talking about processed carbohydrates. And understand, when you combine certain fats with carbohydrates, creates an even bigger problem. Oxidative stress, all that type of shit. Sugar shit and fat combined is a huge problem in and of itself. So don't let the fat be a trans fat like you get with industrial seed oils. Let it be an industrial seed oil that's the fat. You fry a potato chip in that industrial seed oil and put that in your body. So now you have the oxidative stress from the oil, right? The oxidized oil, which creates oxidative stress. Then you have the potato, the starchy shit, gets broken down. You got the sugar shit. You got the sugar shit and the fat. Oxidative stress, insulin resistance. This is what they're selling to you. You go to the grocery store, you see all the potato chips. Dipped, saturated with goddamn industrial seed oil. And then you got the potato chip itself, which is basically sugar. It breaks down into sugar. It's a carbohydrate. You got that, and they put those same industrial seed oils in your honey buns, and your goddamn Oreo cookies. Everywhere you look, hydrogenated canola oil, hydrogenated oil here, this hydrogenated oil, that sunflower oil, this oil, that oil, this oil, all over the fucking place. And you wonder why 70% of the people in the United States have diabetes. You wonder why you go to a school and more than half of them little kids are roly-polies. Because you go and buy big old boxes of chips, you let them just have at it. Oh, yeah, go ahead. Yeah. Yeah, go get those highly processed potato chips. Go get the goddamn goldfish and the this and the that. And then you let them have cookies. They go to school and then they give them cookies and they give them more sugar shit. They're being bombarded with sugar shit all day, every day. And we have a healthcare system in place. How is it that we have a healthcare system in place regulated by the Food and Drug Administration? We have the food companies that are regulated by the Food and Drug Administration that is supposed to look out for the people, allowing this bullshit to be put on the shelves for us to have access to. And we believe that these same motherfuckers, if they just, let's give everybody universal health care. We'll take care of everything. Oh, how's that working out right now? Ain't nothing wrong with some snacks? Sure, there's nothing wrong with some snacks. Make some snacks at the house using whole ingredients. Your kids want potato chips? Have them cut them damn potatoes up. Get some beef tallow. And if you want some chips, make them work to make the chips. Yeah, they got to spend 20, 30 minutes to an hour just to make a handful of chips. That tallow is going to satiate them a lot better than that industrial seed oil bullshit. Yeah, you want them to have some snacks? Make some snacks at the house. Make them put in some work. By the time they're ready to eat the snack, they tired from making the goddamn snack. They might eat a little bit. If they got to make their own snacks every time they want a snack, they'll be less inclined to eat that processed bullshit. But see, the healthcare system is not going to tell you that. They're going to tell you, oh, well, your child has type 2 diabetes. But he's only 6 or 7 years old. Well, they have type 2 diabetes. Now we got to give them medication. That's what they're going to tell your child. Because they don't want to call your child fat. They don't want to tell you, your child is obese. Your child is metabolically unhealthy. That's the first problem. Well, doc, what do we do? Well, what types of foods do your child eat? Start with that. Oh, well, they eat the potato chips. They eat the goddamn cookies. They eat the cupcakes. Okay. Well, let's start with that. Let's stop giving them potato chips, cookies, and cupcakes. Let's stop that. Well, they're just kids. So what? Look, you see your child? Hey, your child has type 2 diabetes and is 30 pounds overweight. Well, they got a sweet tooth. Okay, we'll give them a goddamn apple. Give them an orange. What about orange juice, doc? No. So you want to give your child sugar water? No. Make them eat the whole fruit because it's going to have the fiber and all that stuff. Your body is going to take time to break it down. At least with a piece of fruit, it'll take time, right? That's what your doctor should be telling you about your fat ass child. All right, doc. And you know what else you need to do? Does your child play sports? No, he's more than an academic. Put his ass in sports. Put your child in a sports program so they can work out, so they can go through a fit. Because I don't know what it is. When I was in school, we had PE every day. Every day. When I was in school. Every day was PE. Now they got PE once or twice a week. Hell, my daughter, who's in high school right now, she ain't got no PE classes. I'm like, what you mean you ain't got no PE classes? I was befuddled. You don't have PE classes? I say, all right, take your ass to track. Yeah, you gonna sign up for track. I made her sign up for track. Now she goes to track practice every day, 4 days a week. After school for a whole hour and a half. Her ass is running. No fucking PE. They don't. She's in the 10th grade. They don't make you do PE at all. You don't have to take any PE courses. When I was in high school, it didn't matter if you was an honors, because she's in honors classes right now. It didn't matter. No, your ass is going to goddamn PE every day. They don't even put them children through PE every day. No, I made her ass sign up for goddamn track. I made my other kids sign up for sports. No, you ain't about to not do no PE and then not do a sport. Man, crazy as hell. But this is what, yeah, the government is allowing schools to not make kids do PE. Yeah. Latricia Montgomery says, why I was like really mad because somebody said, I'm rich, I never eat McDonald's before a day of my life. They're a damn lie. Didn't The Rock say that stupid shit? Listen, the bottom line is this. The healthcare system in this country is already being regulated by the government. And they're doing a piss poor job in this country with so-called healthcare. Because there is no healthcare, there's sick care. They treat illness in this country. They treat sickness. They treat sickness. They don't care about preventative care. They don't want to push. Listen, this is just what it is. It's sad, really. It's sad. But I did see, right? I was very surprised. My daughter's school had a homecoming football game. And I was very surprised. I was pleasantly surprised. I didn't see more than 3 fat kids at the game. I did not see, of course, everyone in the school didn't go to the game, but it's homecoming. I didn't see a bunch of fat kids. I was like, okay. I was surprised to see there wasn't a bunch of fat kids waddling around. I'm like, okay, good. Yeah. So when I took my daughter to open house before, classes, before the school year started, I didn't see a bunch of fat kids running around. I was like, okay, cool. That was good. But I've seen a bunch of fat kids at schools in LA, in other places. Listen, man. I'm gonna get off of this thing, man. I'm tired of preaching y'all about healthcare. Healthcare is about going to the hospital as little as possible, or healthcare is about not having to go into a doctor's office every week because you're sick as a dog. Healthcare is not about treating sickness, focusing on treating sickness more than preventing the sickness in the first place. Educating people about fitness, right? That's what the focus should be. Yeah, do they have, they show little pamphlets. Yeah, you can go to the hospital waiting room and you'll see a pamphlet and it'll tell you to walk 20 minutes a day and, lift weights 10 minutes a day and you'll be, listen, right, cool. But that's not the focus. The focus should be never having to bring your ass to this hospital in the first place. What can we do to keep your ass out the hospital? What can we do to have you only come to the doctor once a year for a checkup and check your blood work, making sure you're good? That's what the focus should be. Keeping your ass out this hospital, keeping your ass out this clinic, unless you have certain conditions where you just can't help it. They might say you never act like you had some Twinkies. Of course I had Twinkies. But see, I was eating Twinkies when they had less ingredients in them, right? Twinkies, honey buns, they had like 3, 4, 5 ingredients. Now them things got like 30,000 ingredients in them. Different when I was growing up. But even back then, That was really when it started. 60s, 70s, and 80s. All that processed crap that they want your kids to eat. Make your kids addicted to sugar. They put chemicals inside these foods to make them addictive, y'all. You know, in other countries, that shit is outlawed. The same companies that sell us that bullshit over here, they don't sell that in other countries. The same companies. You look at the packaging for the same shit they're selling you here that they're selling to you like in Canada or the UK. Completely different ingredients. So that, what does that tell you? It tells you that these companies can sell you healthier products. They just don't want to. They're not being held accountable to. They're not being forced to, like they are in other countries. You sell in this country, you're not gonna put that bullshit in your foods. So that lets you know they can do it. They can. You know, it's just, if they're not being made to, if they're not being held to account, if our illustrious, benevolent, beautiful government isn't going to make them stop putting that poison in our food, they're going to put the poison in the food. They're going to put the poison in the medication. They're going to put the poison in the vaccines. They're going to put the poisons wherever they can. Yes, the big, beautiful, illustrious government that y'all want to run universal health care is allowing them to poison us. Yes, that is the reality. Latricia Montgomery says, yes, you're right. We can't really trust these people to actually care. Because they don't care. They don't. But you go to their households, you see how their children eat. Night and day difference. Yeah, they don't have that bullshit. No, they got private chefs. They're going to make their little homemade snacks with 3 or 4 ingredients. That's what their children are eating. Hell, and if the children do eat that crap, they got to sneak out the house. They got to go to their homie's house. Man, let me get one of them potato chips. Yeah. Yeah. They don't subject themselves to that bullshit. Absolutely not. Anyway, y'all, I'm going to get out of here. Just wanted to come through and say why I say, FRUCK, your government ran universal health care. I don't want it. But anyway, y'all, thank you for coming through. Thank you for hitting the like button. You know, for those who were here, I appreciate you. No, they have to figure it out how to capitalize on our bad eating habits. Bada boom, bada bing. It all ties together. Bad eating habits at home end up in the hospital. Big Pharma sells their drugs. Insurance companies charge you out the ass through the government, through taxation, right? Because you're still paying for it. This is all linked together. All this shit is tied together. It starts with optimum healthcare starts with what you do with your own body, what you put in your body, how much fitness you put yourself through, right? Yeah, that's what healthcare is really about. No problem, Susan Sullivan. No problem. Black Spring says a lot of our food is banned in Europe. Yes. Yeah, a lot of it. And it's no wonder they're healthier in Europe, right? So what I'm talking about is our government here in the United States that allows this poison, to be accessible by their people. You want them to run universal health care. It's wild to me. But anyway, thank y'all for coming through. I'm going to holler at y'all later. And I'm going to keep bringing y'all this information. But anyway, y'all go check out the video with Dr. John Campbell, where he's talking to another doctor about, you know, a lot of things, right? There's a lot of education in that video. Very good conversation. You can tell that they actually care. And it's just not enough of those types of healthcare workers in the United States that really want to put that education out. He breaks down what type of blood work you want to get when you go to the doctor, right? Basically, so it's not just about the A1C when it comes to diabetes. There are other, you want to check and see how much insulin you have, right? And then there's a particular calculation I'm not going to get into. Y'all can let the I'll let the professionals handle that. But your doctors aren't doing these things that he's saying is going to go a long way to ensuring you don't end up in a place where, by the time you have diabetes, basically what he's saying, by the time you realize you're pre-diabetic, your body is already metabolically, by the time you're pre-diabetic, you got some shit fucked up going on. Yeah. So y'all go check out that video. I posted it on the community tab this morning. I might even put it in the description. But it's very good information. Anyway, I'll holler at y'all later. Much love. Like, share, subscribe. And let's keep marching forward toward freedom. Peace.